Hi everybody, welcome to this class. In this class, we'll be discussing about regional injuries. So in the topic of regional injuries, there are certain subtopics like, for example, a skull injury or road traffic accidents, which are very important and can be asked as shorts as well as long answer in your exam. So let's look into what are the important questions that we'll be discussing in this chapter. The number one in the essay part, we'll be discussing two questions. We'll be discussing about the different types of skull fractures, coup fracture and the countercoup fracture. So this is one thing that can be asked even in your Viva VOC. They'll ask you what is the difference between a cup and a countercup injury. And also we'll be looking into one more essay where we'll classify injuries and we'll learn about the different types of intracranial hemorrhages. Now coming to the different types of intracranial hemorrhages, this is a very overlapping topic, okay? You'll have to know about it in your NAT, you'll have to know about it in your forensic medicine, in your medicine, in your surgery. So this comes in so many places. That is the importance of this topic. Coming to shorts, we need to know about whiplash injury. We need to know about primary and secondary impact injuries, punch drunk syndrome, and also lucid interval. So we're discussing about all these. So dive in and let's get started. So before we start, we need to know about the app, okay, Auricle. So what is Auricle? It is a platform which gives you various things at a place, okay? So you have recorded classes, you have live classes, you also have practical sessions, exam module, and hard copy book set. And all of these are available at a single platform. Okay, now coming to in-depth about recorded classes, what do you get in recorded classes? So recorded classes offers you a flexible learning experience where you can use the app to study anywhere at the ease or comfort of your home or wherever you're comfortable at, okay? And the instructors are going to clearly explain to you every concept, no matter how small or large a concept, everything is given equal importance and is seen to it that you all understand about the topic properly. And because these are recorded classes, you can revisit it and watch a number of times. That's why it is going to offer you a convenient platform even for revision. Now, coming to live classes, we have curated live classes in such a way that we're going to cover all the important topics, past 10-year, previous year questions, and these are the questions that are most anticipated to be coming in your further exams also. That is why when time is a constraint, you can stick on to live classes so that you'll be, there's that compulsion for you to sit for that 1 hour and listen to these classes where we will cover the most important topics so that you can anticipate what questions might come in the future exams that will be giving. And the examiners here will also tell you about how you need to build on your answer writing skills, how you need to build study plans, and so many more. Basically, here not only teaching concept is given priority, but also you getting a lot of marks out of what you understood is also given priority. Here we also have doubt clearing sessions, MCQ polls, Viva VOC, and so many more, which will ease your learning experience. Coming to the express exam module, in the express exam module, the entire syllabus of each subject is covered in less than 20 hours. That is where it gives you a comprehensive and effective coverage of the entire syllabus. Here also, we're going to guide you through the answer writing skills. We'll tell you what diagrams to put in, what flowcharts to put in. This way, your answers are going to be much more efficient in the paper. And the educators here are in the field of teaching from a very long time, so they know exactly what you need and will cater to those needs. There's also one-to-one doubt clearing sessions that is provided in the app where a student-centric approach is taken. It is one-to-one. No, one-to-one meaning one teacher to one student. So every doubt of a student, no matter how big or small, can be cleared here. And here the educators ensure that you're taken care of and your base of the subject becomes concrete. Personalized attention is given to all the student, and these sessions are designed in such a way that it will cater to the individual learning needs and academic journey. It's a safe learning environment where you do not have to be worried about any judgment. Here you're going to study everything in a supportive and understanding setting, okay? Now apart from this, we also have hard copy note set. So the hard copy note set will give you in-depth coverage of the entire syllabus. It is very good for a picture skew memory because here we have a lot of things. We have images, we have flowcharts, we have flashcards, and all of these are in a colorful manner so that you're going to get that picture skew memory, and it's easier for you to retain and recall and write your exams. Okay, and we also have Q bank. Okay, so coming to the Q bank, we have 3 levels of Q bank. We have the beginner level, and in the last level is going to be the expert level. So, and the one more important thing about the Q bank is that it is a customizable Q bank. That is, whichever topic you're studying, you can select questions from that topic and solve. So that will be your active recall of whatever you have studied. That way, it is going to help you. And the questions here range from Proff exams, NEET, PG, and FMG. So you're taken care of for all these exams. Coming to the practical sessions, so practical sessions is an add-on for you. It is not covered in so many other apps. Here we are trying to bridge the gap between when actually practicals happen in the college and when you actually go and give exams. So there's a significant time delay between both, and a lot of students tend to forget whatever they've learned in practicals. We here try to bridge that gap. We are going to give you hands-on experience on the various case scenarios that can be there in the exam, and these are going to be interactive sessions where you can build on your concepts, and you'll also get expert guidance about how you need to approach practical exams. We'll also tell you the important viva questions that can come. We'll also give you an insight about the spotters. So this way you're taken care through the practical exams. Now, coming to the various subscription plans that are there in Auricle, we have foundation plan, advanced learning plan, complete learning plan, as well as ultimate MBBS plan. Coming to the foundation plan, it is a foundation, so it's a basic one. It's there for 3 months. Here we offer you pre-recorded classes, live classes, express exam module, practical sessions, Q bank. So these are the things that you'll be getting in the foundation course. And when you get the same thing for a period of 6 months, it's nothing but the advanced learning plan. And coming to the complete learning plan, as a word suggests complete, so you also have additional hard copy notes set and one-to-one doubt clearing sessions that you get here. And then we also have the ultimate MBBS plan, where the entire plan is for 4 years. That is, when you join MBBS, you can take it and you're taken care of through and throughout your MBBS. So that is the essence of ultimate MBBS plan. So you can use the coupon code Dr. Prashi Kaveri 20 for additional discount on your subscription. Now let's dive into the subject per se. Coming to regional injuries, so as I told you here, the important questions that you'll have to know are about the skull fracture and the motorcyclist fracture. That is, anyone who is using two-wheeler, they tend to get this motorcyclist fracture. And whenever there is a road traffic accident, what are the things, the primary and the secondary impact injuries that happen to the pedestrians as well as to the front seat occupants of the car? So these are the things that you have to be knowing here, and these will also help you whenever you're in charge of a hospital, you're working as a medical officer. All these other very common cases that you'll be getting whenever there is an RTA. Now, coming to the first essay, we'll be discussing about the different types of skull fractures, and along with that, we'll also see what is coup injury and what is a countercoup injury. Now, coming to the different types of skull fractures, number one is a fissured fracture. As you can see in the image here, you can see a line running through the skull. No, this is nothing but it is a fissure. So whenever there is a fracture in the skull, which will look like a fissure, a small narrow opening, it can be as thin as a hair, it is called as a fissured fracture. So it looks like a line. No, it's a linear fracture and involves the whole thickness of the bone. That is the outer table of the skull, the inner table. Now, for example, if this is the cross section of the skull, you have the outer table as well as you have the inner table. No? So this fissured fracture is going to involve both the outer as well as the inner table of the skull. And how are these fractures caused? These are caused by forceful contact with a broad surface. For example, when the person forcefully he is thrown into the ground, when he comes into contact with such hard surface, which is also very broad, ground is a very big area, no? Such are the instances when fissured fracture occurs. Okay, so it is going to start at an impact. Now, for example, if this is, imagine this is the part that came in contact with the ground. Okay, so fissured fracture is going to start at this point and it is going to run along the direction of the force. So if the force is like this, the fracture is also going to run in this direction. So it is going to run in the direction of the force, and these are very thin. Okay, it is a hair's breadth. If you can touch your hair and feel so thin, no? So a fissured fracture is as thin as a hair's breadth. Coming to the second type of fracture, we have depressed fracture, where there is a local deformity of the skull. It's a small, now if this is a skull, area of the skull is going to be depressed. Wherever there is an impact, there is going to be depression seen. It is caused by heavy weapons. For example, any heavy weapon like a stone, axe, chopper, or hammer, all of these which are small and heavy are going to cause a depressed fracture. These are also called as fracture a la signature. What do you mean by fracture a la signature? It means that whenever there is a pattern in any of these heavy weapons, the pattern can be noted on the depressed fracture. Therefore, it is called as fracture a la signature. So whenever the word signature is mentioned, that means that you can identify the weapon that caused the injury. Got it? So the second one was depressed fracture. And in depressed fracture, as you can see the image here, no, this is depressed fracture. As you can see, this part of the skull has been depressed. It has gone inside. Okay, and the diameter of the bone driven inwards is same as a striking object. For example, if this was a hammer that caused the impact, the diameter of the wound, as you can see, is same as the diameter of the weapon that caused the injury. Then whenever there are multiple blows that are given, it is going to consequently weaken the skull, and then there is going to be damage out of proportion. That is, imagine if this is the instrument that is used and you're going to blow everywhere in the head. When you blow everywhere in the head, the entire skull bone becomes weak, and you're going to have so many fractures, and the surface of that fracture is much more than the diameter of the object which caused the fracture. Got it? Now, coming to the third fracture, we have elevated fracture. So when do you get an elevated fracture? You force which is going in a tangential axis, where it is going to elevate a portion of the skull. It is going to elevate a fragment of a skull. That occurs when a tangential force is given. That is called as an elevated fracture. Next, we have a comminuted fracture. What is comminuted fracture? Comminuted as a it means so many pieces, multiple fractures, so many pieces, called as comminuted fracture. That is, there are two or more intersecting lines which divide the bone into so many fragments. Now, as you can see here, there is a line here, there is a line here, then you have a fracture here. So these are going to divide the entire bone into so many, fracture fragments. So these are the so many fragments that are seen, and because there are so many pieces, it is called as a comminuted fracture. Okay, so this is caused whenever there is an impact which occurs, or like for example, of fall from a very long height, and for example, from the 10th floor, a person jumps on the ground, or there is a vehicle accident. All these are the examples that would cause a comminuted fracture when the impact is going to be very strong. That is when a comminuted fracture is seen. Next, we have a pond fracture. What do you understand by pond fracture? As name suggests, pond. How is a pond? It is but a shallow depression where water is stored. No, so in the same way, if the skull looks like a pond, it is called as a pond fracture. And when does it happen? When it is not completely fractured, but there is a bend, there is a dent in the skull. Why there is a bend and not a break? Usually whenever there's a fracture, it has to break, no? Then why are these people calling a dent as a fracture? Because in some skull, for that, like for example, skull of an infant, the infant skull is going to be very elastic. When it is elastic, it is not going to break, but in fact dents inside, causing a pond fracture. Okay, so what happens? The inner table is not fractured. Inner table in the sense, the inner side of the skull is not fractured. Therefore, there is going to be only dent that is seen, and this is called as a pond fracture. Now we have gutter fracture. What is gutter fracture? Gutter fracture is formed when a part of thickness of the bone is removed in the form of gutter. For example, now if this is a skull, you have a part that is removed. So this much part of the skull is going to be removed. Then what do you get? You get this area which represents nothing but a gutter. So this is the gutter that is there because a part of the skull is removed. Then we also have ring or forearm fracture, which is nothing but a fracture which encircles the skull such that the anterior third is separated from the middle and the posterior third. That is, if you can see in the image here, no, this image, if this part, this is the anterior third of the skull, then we have the middle third of the skull, then we have the posterior third. So if there is separation of the anterior 1/3 from the remaining part of the skull, then it is going to be called as, what is it going to be called as? It is going to be called as what is it going to be called as? You tell me. A foramen fracture. Got it? Next, we have the perforated fracture. What is perforated fracture? Perforation means it is a big tear. It is nothing but a through and through opening. It is caused by a firearm or a pointed sharp weapon. Okay, now if this is a skull, in perforated fracture, there is going to be an entry wound, there is going to be exit wound. So there is through and through bursting opening of the skull. Then we have sutural fracture, where a suture line is separated. We have so many sutures. No, we have sigmoid suture. We have so many sutures, and if the fracture is along the suture line, it is called as sutural fracture. Expressed fracture, that is massive fragmentation of the skull where some pieces may be found outside the head. That is something, what do you understand by the term expressed? Something that is taken out from a entire group. Expressed means taken out. That is, if a part of a skull is taken off from the skull, it is removed, it's somewhere outside, then we call it as an expressed fracture. Now we look into the second part of the question. What was the second part of the question? It was about coup and countercoup injury. So what is coup? Coup is an injury that occurs at the area of impact. Here also, see, any question pertaining to skull, if they ask, you put an image. As simple as a circle would signify a skull. Okay. Now you put a hammer or a heavy cutting object, and if this is causing an impact here at the site of impact, we are going to have a coup injury. And opposite to the impact, which is the opposite side of impact, this that I've marked within cross mark, this is an opposite side, and the impact there is called as a countercoup injury. Got it? So these countercoup injuries are basically found opposite to the side of a coup injury. Why is a countercoup injury caused? You might ask, no, ma'am, there is an impact in one side. Okay, there is an injury caused because of a blow with a hammer or something. That is coup injury. Got it. Why is there an impact on the opposite side? There is impact on the opposite side because whenever there is a coup injury, there is also changes in the structures that are there inside the skull, the brain and all. No, there's going to be rotational changes which occur, and because there is rotational changes, there is going to be impact that is there, which is seen on the opposite side as well. And also what happens now, whenever there's impact on one side, for example, imagine there is impact on the right of my skull. My skull is going to move like this, no? So when this moves, the inside, the whatever brain matter is there, that is also going to move. And finally, after it moves certain place, there is stoppage of the movement of the skull, no? But even then, the brain which is moving will go and hit on the skull this side. So there is going to be impact on the opposite side, and that is the reason why there is a countercoup injury occurring. Got it? Because of the deceleration of the brain, it is going to go and hit on the opposite skull, which results in an injury called as countercoup injury. Okay. Now, there is also another factor which causes this countercoup injury. It is nothing but certain people say that there is formation of the vacuum in the cranial cavity whenever there is an impact. See, for example, whenever a hammer is hitting my head, there is going to be a vacuum that is created, and because of which on the opposite side of impact, there is vacuum created as the brain lags behind the moving skull, and that is vacuum is a reason causing the brain to go and hit the opposite skull, and there is injury that is occurring. Okay. So the two theories, one is the deceleration theory, and what is the second theory? It is the vacuum theory. Remember these two things. Make note of it whenever they ask a coup or a countercoup injury. So continuation to what happens whenever a vacuum is created. This vacuum, what is the function of any vacuum? Like a vacuum cleaner, it's going to suck in everything inside it, no? So similarly, when a vacuum is created in the opposite side of impact, it is going to suck in the brain and it is going to damage the brain. Okay, got it? So you can see in the image here, wherever there is a fist blow, this is a place where there is impact, and this is the place where you're going to get a coup injury. And in the opposite side, either because of deceleration or because of damage or sucking in because of the creation of vacuum in the opposite side, we have nothing but a countercoup injury. Try putting this diagram, it will help you get extra marks in your exam. Coming to the second question, we'll classify the different types of injuries, and also we'll look into the different types of intracranial hemorrhages and the cause of death due to intracranial hemorrhages. Okay. Now, when you come to intracranial hemorrhage, what is a broad thing that you understand? It is nothing but bleeding in the brain matter. So coming to the bleeding in the brain matter, there is different types of bleeding. Okay. So we'll be looking at all these different types of bleeding. Now, firstly, coming to the first part of the question, we need to know about injury. What is injury? Any injuries means there is a breach in the natural continuity of skin and mucous membrane. Okay. So see, this is a top now, whatever topic we're discussing, this topic is about regional injuries. No, but the first part of the question that came here asked just about the injury. And where did we study the definition of injury? In the previous class, we studied it under mechanical injuries. So understand that in your exam as well as MCQs, different chapters will be coinciding. They'll mix up different chapters and ask. That is why you can't skip chapters. Okay. Even if you do not have time, try to focus on the important nook and corner of the chapter so that you have chances of scoring extra marks. So this first part of the question was from the chapter of mechanical injury, where injury means any breach in the natural continuity of the skin as well as the mucous membrane. Whenever there is a breach in the continuity, it is called as injury. So for this injury, not only a medical definition, we also have a legal definition. So what is a legal definition? That is anything that endangers a person's mind, body, reputation, or property. So there could be damage not only outside, okay, not only something that is seen medically, but a damage to a body, mind, reputation, property. All of these together is said as the legal definition of injury. Okay. So what are the things that could be damaged? Body, mind, reputation, as well as property. Now, coming to the different types of mechanical injuries, we have those which are caused by blunt force. What do you understand by a blunt force? Like, for example, fall on a ground. The ground, which is a hard resisting surface, is a blunt force. Hitting by a wooden board, wooden plank, that is a blunt force. So, injuries caused by such area like ground or a plank, these are all come under the injuries caused by a blunt force. For example, abrasion, we have bruise or contusion. Remember it by ABC. Abrasion, bruise. Other name of bruise is nothing but contusion. Then we have lacerated wound and we have fracture dislocation. So these are the four things that come under injuries caused by blunt force. We also have injuries caused by sharp force. What are these injuries? These are nothing but the incised wound and the stab wound. Incised wound is when the sharp surface of a weapon is moved along the body in a little superficial manner. We get incised wound. And when we take the weapon and try to use a lot of force and put it inside the person's body, it is called as a stab wound. Also, we have injuries which are caused by firearm. So got it? This is a classification. First, we need to write about injuries caused by blunt force, then sharp force, then firearms. Okay. And this part of the question is from the previous chapter. It is from the mechanical injuries. Now, coming to the main question, we have to tell about the types of intracranial hemorrhages. Okay, so coming to types of intracranial hemorrhages, we have extradural hemorrhage. As you can see in the image, no. By the end of this question discussion, I want you all to be able to identify by looking at a CT or MRI whether it is an extradural or a subdural or a cranial hemorrhage. Okay, so firstly, coming to the extradural hemorrhage, as you can see in the image, what is the shape? It is a lens shape. It looks like a convex lens, no? So an image of X-ray, a CT or a MRI film, which shows a hemorrhage in the form of a lens, a convex lens, is nothing but that of an extradural hemorrhage. So how is an extradural hemorrhage caused? It is caused mainly because of trauma. Okay, a high impact trauma is going to cause a extradural hemorrhage. A blow over the lateral convexity of the head. So here, whenever you blow, which are the convexities of the head? These two are the lateral convexities of the head. Whenever a tight blow is given to one of these convexities, there could be injury of the middle meningeal artery, which might cause a lot of bleeding, causing extradural hemorrhage. Remember the cause. One of the important questions that might come as your MCQ is, what is the artery or what is a blood vessel that is involved in extradural hemorrhage? It is nothing but middle meningeal artery. Got it? And remember one thing, this extradural hemorrhage, no, it happens only whenever there is a very severe impact. So it is not very commonly seen. Only 1 to 3% of the cases of the head injury could be an extradural hemorrhage, whereas intracranial and subdural are most commonly seen. And this is common in individuals who are 20 to 40 years who are involved in a high impact activities. For example, whenever there is a road traffic accident, whenever there is an injury, like for example, hit by a cricket ball, these are the high velocity injuries which could cause extradural hemorrhage. Got it? It is arterial in nature. It could be seen where there is fall from a height or being struck by a moving object. For example, as I told you, injury by a cricket ball. So these are the things where there is extradural hemorrhage that is seen. Okay, in all the cases there is going to be hematoma, and hematoma is seen directly under the site of the surface. So for example, the ball hits this right part of the skull, there is going to be hematoma seen here only, not somewhere else. In the same area of impact, we are going to see the injury. And to cause death, if you have even minimum of 100 ml of blood, that is enough to cause death. Okay, we have to ask the history of head injury, and we should also ask whether there was lucid interval or not. Okay, usually whenever there is extradural hemorrhage, it is always characterized, like for example 30 to 40% of the cases will have something called as lucid interval. So lucid interval can be seen even in subdural hemorrhage, but it is mostly characteristic. Characteristic meaning that whenever there is a lucid interval, your first thought in brain should be it is a extradural hemorrhage. That is a period of temporary consciousness that happens after a period of unconsciousness. That is, the person is being hit by a cricket ball, he becomes unconscious, he faints. Okay, and after a while he just gets up, he tends to be normal, he tends to talk, and then again he goes back to that unconscious state. That middle period whenever he was conscious is called as lucid interval. Okay, and the person may not even remember that such thing happened with him. Got it? Next we have subdural Okay, how does it look like? It is a concave shaped. It is a banana shaped. It is either, you can call it as a concave lens shape, or it is a banana shaped hemorrhage which is seen. And when you see such an image, a moon shaped, crescentic shaped image in the CT or MRI, your suspicion should be towards subdural hemorrhage. Got it? It is a bleed which are mainly the rupture of the bridge or communications. It occurs from the slight trauma. Like, for example, in old age, when the person tries to take bath, he tends to slip in the bathroom and fall off. Or an old age person loses grip and he slips in the staircase and falls off. These are all not a very high impact injury. These are low velocity injury. And in such cases of low velocity impact, we get a subdural hemorrhage. Okay, and it is usually seen in alcoholics and children and in people who are of old age, because these people are not very aware. Like alcoholics, they don't have consciousness, they tend to slip and fall off. They don't go and fall off from height and all that. Usually somewhere in the roadside, in the gutter, they fall off. So these are the low velocity injuries which are going to cause damage in the communicating veins and cause subdural hemorrhage. We have the third type of hemorrhage called as subarachnoid hemorrhage. And subarachnoid hemorrhage, remember, it is usually occurring because of a rupture of an aneurysm. For example, most common, a rupture of a saccular berry aneurysm. So that it is causing subarachnoid hemorrhage, and it is mostly seen in alcoholics. And remember, subarachnoid is the most common type of traumatic intracranial hemorrhage. We discussed earlier, no, which is the least common type. Least common type is nothing but extradural hemorrhage, because it wanted a high velocity impact. And the most common type is nothing but subarachnoid hemorrhage. Remember this might come as an MCQ. And here also it is a venous type of hemorrhage, and there is going to be one characteristic finding that you can see in the subarachnoid hemorrhage is that there is going to be slight yellow discoloration of the leptomeninges seen. And whenever you try to do a CSF tap in case of subarachnoid hemorrhage, there is going to be xanthochromasia that is seen. What is xanthochromasia? Xanthochromasia is yellowish orange coloration of the CSF. It is seen in case of subarachnoid hemorrhage. Okay, got it? So this is how you have to differentiate subarachnoid hemorrhage. Next, we have intracerebral hemorrhage. What is intracerebral? Then it is nothing but the hemorrhage into the brain. Okay, and whenever there is a hemorrhage into the brain, it could be seen in different types of cases. For example, severe cases of hypertension, there could be rupture of the arteries in the brain which could cause a intracerebral hemorrhage. Okay, and usually whenever there is an intracerebral hemorrhage, amnesia is seen. What do you understand by amnesia? That the person forgets that whatever has happened during that time, no, he's going to forget it because of the pressure effects. Because of the pressure effects, he is going to forget whatever is happening, which is called as amnesia. Got it? Now, coming to the shots. In shots, the number one is whiplash injury. So what is whiplash? Soft tissue meaning what type of soft tissue? The muscles, the strap muscles of the neck is involved, thyroid is involved, hyoid bone is involved. So all these structures which are there in your neck, no, this is involved whenever there is a whiplash injury. It occurs because of sudden jerking motion. So the entire neck part and the head is going to move like this. There's a jerk, that is a sudden forward movement. What is jerk? It's a very small, brief impact. Tuck, tuck, that is jerk, no? So when that happens near your neck, there is going to be a whiplash injury that is seen. Okay, and it occurs because of a sudden and forceful movement of both your head and neck, and often in the rear, when a rear end vehicle strikes. So what happens whenever you're driving, imagine you're there in a lot of traffic. Okay, bear with my image of the car. I'm going to see. So what happens? So here, imagine the person is going to drive in this way. Okay, this vehicle from back comes and hits the vehicle that is there in front. So when this happens, when there is impact, the rear end, the backside vehicle hits, the front seat occupant is going to suddenly jerk off to the front. And when it goes like that, there is going to be rapid acceleration. That is, the head is going to move front with acceleration, and then it's going to come back slowly. And deceleration, following deceleration, and that is why there is going to be damage in the neck structures. Okay, so what are the symptoms that are seen? There's going to be neck pain, there's going to be stiffness in the neck. Apart from it, there's going to be headache, there's going to be dizziness, there's going to be shoulder pain, there's going to be numb. And because there's shoulder pain, all the brachial plexus nerves are involved. And when these nerves are involved, there's going to be tingling and numbness, which is seen in the hand muscles, in the arms. So these are the various signs and symptoms. Remember, they ask a question about whiplash injury. Try to imagine the situation, okay? You try to do that movement, a jogging movement of the neck. So there's neck pain, head is moving, there is headache, and what is there below your neck? You have the shoulders. No, so shoulder also, there's little impact. So there is shoulder pain. When there is an impact on the shoulder, when brachial plexus is injured, there's tingling and numbness of the arm. So this is how you need to imagine and write answers in forensic medicine. Forensic medicine is a lot of common sense, okay? If you can analyze the situation well, you can come to the answer, and same applies to whenever you are answering a question also. Analyze the question properly, you'll be able to write the answer, okay? Going to be hyperextension, later is going to be hyperflexion, and this movement is something that causes strain in all the muscles that are there near the neck, the strain in the ligaments and tendons of the neck, breakage of these, which is going to cause damage. How do you diagnose? You can use X-ray, you can use CT, you can also use MRI, and all of these are used in order to check for any fractures, any of the discs of the vertebrae, if they are herniated or not, or any other structural damage can be found out by X-ray, MRI, and CT. So what is the treatment? You have to pain management, because it's a very painful condition. You have to give anti-inflammatory medication so that there is going to be a decrease in the inflammation around the neck area. You can give physical therapy. You can suggest physiotherapy to the patient, and also neck support. A soft collar can be worn by these patients so that there is not much impact in the neck area, and a fast, speedy recovery can be sought for. Okay. Coming to the second question, what is the difference between primary impact injury, primary injury, and what is a secondary impact injury? Okay. So primary impact injury means the part of the body involved depends upon the position of the person in relation to the vehicle. This is something that you have to know, okay, initially. For example, whenever there is an impact with the vehicle and the person, the initial injury that is caused because of the impact of the accident is nothing but the primary impact injury. And this depends on where the person is standing. For example, if the person is standing in front of the vehicle, there will be injuries near the knee joint, there will be injury in the lower arm, lower limbs of the person. Whereas if the person was standing in the side of the vehicle, there's going to be injury in the shoulder area, in the arm area, in the waist area. This is what you have to understand. If the injury depends on the relative position of the vehicle as well as the person. For example, bumper injuries, victims are struck from behind. For example, if this is a car and there is a victim that is standing here, okay, this person was going forward, okay, that is his head is facing backwards, okay, and if this bumper goes and strikes the backside of the person, there is going to be a lot of injury where in the behind the knee joint, backside of the lower limbs, there is going to be a damage, and tibia bone could be fractured in most of the cases. If the person is facing the vehicle, that is, he's moving through the, this is the vehicle that is going, facing vehicle, and there is a lot of damage in the abdominal structures of the person, in the stomach area, intestine, in the chest. These are the areas where there could be a lot of injuries. Okay, there might be a lot of lacerations that can be seen. There could be contusions that are seen, abrasions that are seen. So various types of image, the damage or the injuries that we studied in mechanical injuries could be seen in the case of primary impact injury. Okay. And if it is a fast moving vehicle, because it is in a high velocity, the impact is going to be even more higher. Now, coming to the secondary impact injuries, these are caused when the body hits the vehicle. For example, when the vehicle hits the foot, the upper part of the body falls. Now, what you have to understand is, as I told you, primary impact means, now this is the vehicle that is going and this is a person walking. So initially, when this impact happened, at the area of impact, whatever damage occurred is nothing but primary impact injury. Secondary means, the same, let's look at the same example. The vehicle is moving like this, person is moving to the vehicle. The person is hit by the vehicle, that is primary impact injury. Now he goes and falls on top of the vehicle. There he goes in the air like this, Try to imagine whatever you typically see in a movie. No, he goes and falls on a vehicle. Now, the injuries that he sustained as a result of fall on the vehicle is nothing but a secondary impact injury, because this is not caused because of impact. No, this is caused when he goes and falls in the vehicle later. So it comes under the secondary impact injury. So upper part of the body, whichever part of the body comes in contact with the vehicle when he falls, is injured. Got it? Coming to the third question, punch drunk syndrome. Drunk syndrome is caused in those areas. There is repeated like whenever a person is playing football, no, 100 times, on the 100 days that he plays, a ball can come and strike his head, or he might try to hit the ball through his head. So these are the cases when there are repeated injury, which would cause a punch drunk syndrome. What are the symptoms? Early symptoms include memory loss. There could be mood swings, irritability, difficulty in concentrating. So basically, remember that most of the symptoms are the CNS symptoms, which pertain to concentration, irritability, mood swings, and even in later stages, there could be later stages in the sense later part of the initial stages, there could be memory loss also. Over time, the condition worsens. His learning capacity, that is, his cognition is hampered. There could be emotional changes seen. And in the very late stages, there could be dementia, depression, as well as aggression, which are seen in the very late stages. So this is nothing but punch drunk syndrome. So what is the progression of the punch drunk syndrome? Syndrome of over the years or decades of repeated head injury. Very rapid one or a very sudden one. It is a very gradual thing that happens. Initially, as I told you, there is irritation, there is going to be memory loss and all. In later stages, there's going to be intellectual disability, there is going to be impaired cognition and depression. As the condition worsens, the individuals may experience tremor, slurred speech, and difficulty walking. A lot of people say that Parkinson's and all could develop in such people who have been used to, like, for example, this person Salim Ali, who was all these people who were in Muhammad Ali, who was a boxer, all these people in the later stages of their life, because they were under so much impact to, for example, the skull injury and all, there could be small micro hemorrhages, micro tears happening in the brain. Later, it could trigger all these, where there could be tremors, slurred speech, and difficulty in walking in their old age. Okay. Coming to the treatment and prevention part, currently there is no cure for punch drunk syndrome. And here, what we do is we try to focus in managing the symptoms rather than treating, because we do not have a cure. Okay, we try to make the person's life easy by correcting his mood or cognitive symptoms, and we try to give them therapy for the movement disorders. This is how we try to focus on managing the case. Coming to the another short, we'll be discussing about lucid interval. So what do you understand? So conscious, it looks feel like the person is well, apparent recovery, or he is in a normal mental state that happens after a period of unconsciousness. Okay, this is called as lucid interval. It is seen usually in a traumatic brain injury or intracranial bleeding. Mostly, which type of traumatic brain injury? I told you, extradural hemorrhage. Okay. And it can be seen in subdural hemorrhage also, but the incidence is very, very low. Even when we talk about extradural hemorrhage also, not every case of extradural hemorrhage will have lucid interval. It is going to be seen only in around 30 to 40% of extradural hemorrhage cases. So what is the duration? The lucid interval typically lasts for minutes to hours, but in some cases it may be very brief or extend longer also. So there is no set duration. Okay, got it? Now, what are the other things that you have to know about lucid interval? Coming to the clinical significance, has been hit by a big ball and he after 5 to 10 minutes, imagine he tries to get up. When he faints, all the people are very panic stricken. They're very scared. But when the person gets up and talks and all, these people get this false sense of the person being recovering. But then it could be just a lucid interval, and the person might go into a state of unconsciousness again. This is what we need to keep in mind. Okay. Coming to the treatment and management, we have to do investigations like, for example, we have to do CT, we have to do MRI, and by looking into CT and MRI, we can assess the type of intracranial intracranial hemorrhage. For example, if it was a convex shaped hemorrhage, it means extradural hemorrhage. If it's a banana shaped or crescentic shaped subdural hemorrhage, if it is inside the brain matter, it means it is an intracerebral hemorrhage. You can tell which type of hemorrhage it is, and then you can plan a surgical intervention. And by the surgery, you can do burr surgery. You can do that, and you can decrease the pressure that is there in the brain, so that the future, like the amnesia and all, could be prevented. This is how you treat a lucid interval. Okay. Now, coming to the MCQs, coming to the first question, which of the following best describes the mechanism of a Coup injury in a traumatic brain injury? So the question is about the Coup injury, and in this, let us look into the options. Okay, injury occurring at the site of impact of the head. Correct, maybe, because we know the Coup injury is at the impact of injury. Option number B, injury occurring opposite to the site. No, if it is occurring opposite to the site, what was it? It is nothing but a countercoup injury. Okay. Injury due to rapid rotation of the head? No. Injury caused by brain swelling due to ischemia? No. So what is the right answer? The right answer for this question is option number A, which is injury occurring at the site of impact of the head. Got it? This is nothing but Coup injury. Coming to the question number 2, a countercoup injury in the context of traumatic brain injury refers to. Let's look into the option. The brain injury occurring at the site of impact, brain injury that occurs opposite to the site of impact, the injury due to penetrating object, the brain injury caused by diffuse axonal injury. So what is the right answer? You know it. We discussed about it in the previous question. It is nothing but option number B. Option number B says that there is going to be injury on the opposite side of the impact. As I told you, if this is brain and if there is going to be impact by hammer that is seen in this area, wherever there is impact, it is nothing but a Coup injury. And on the opposite side of the impact, it is going to be countercoup injury. This is something that you'll have to make a picture skew memory and keep in your brain and remember it for all your MCQ questions as well. Now, which part of the brain is the most commonly affected in the Coup and the countercoup injury? Due to its proximity to the skull. This is something that we have not discussed, but try using your common sense. Okay, which of these places you might feel is affected mostly by a Coup or a countercoup injury? The answer for it is option number B, temporal lobe. Why? Because if this is the head, no, which is the if you use your common sense and think also, what are the options that were given in this question? The options that were given here are occipital lobe. Where is occipital lobe? It is here. Is this the area which has a lot of impact during any injury? No, it is not the occipital lobe. Where is the parietal lobe? Here. So if there is going to be damage in the parietal lobe, the person should fall head down. Does it happen? No. So frontal, yes, the person a lot of times might get a frontal injury, but we have only one frontal lobe, no, so only here. But temporal, like this, he might fall in the left and right, so double chances than a frontal injury. Therefore, temporal is the answer. So in a lot of places in forensic medicine, a good use of common sense is going to tell you what the right answer is. Okay. Coming to the next question, what is the typical clinical manifestation of a countercoup injury? So the question is about countercoup injury, okay? Hemorrhage at the point of impact? No. Because if there's hemorrhage at the point of impact, it is nothing but a Coup injury. Unilateral pupillary dilatation, contralateral motor deficits or sensory loss, or a sudden onset of vertigo. What is the answer for this question? The right answer for this question is option number C, which is contralateral motor deficits and the sensory loss. By looking in there is going to be what is it helping us understand? It is helping us understand where is the site of injury, whether it is a right lobe that is involved or whether it is a left lobe that is involved. Okay, that is when we use the pupillary dilatation, unilateral pupillary dilatation. Therefore, the right answer for this question is going to be option number C, which is contralateral motor deficits or sensory loss. Got it? Now, coming to the fifth question. Whiplash injury is the most commonly associated with which of the following types of sports impact? As I told you, like for example, impact of the cricket ball or dural hemorrhage. Okay. Option number B, motor vehicle accidents, especially rear end collisions. Yeah, could be. Option third, let's look into other options also. Option number C, direct blow to the head. No. Direct blow to the head could cause either a cow injury or some hemorrhage, like extradural hemorrhage. Okay. Fall from a height. No. There could be comminuted fracture that is seen in a fall from height case. So the right answer here for whiplash injury is it is motor vehicle accidents, especially rear end collisions. As we discussed, whenever there is a motor rear end collisions, that vehicle is going to hit the side of the vehicle, car number one. Then there is going to be whiplash injury seen in the front seat occupant. There's going to be rapid hyperextension of the skull followed by hyperflexion. The rapid hyperflexion is acceleration injury, and the deceleration is a hyperflexion, which will cause damage to the soft tissues in the neck area. Got it? Now, coming to the next question. Which of the following symptoms is most commonly seen in immediate loss of consciousness is seen in cases either extradural hemorrhage or a subdural hemorrhage, mostly extradural hemorrhage. Persistent neck pain and stiffness, yes, could be because the neck structures are involved. No, severe headache, nausea, vomiting. No, headache, nausea, vomiting is also seen in cases of intracranial hemorrhages. Hemiplegia, no, hemiplegia is also seen in cases of brain injury. Therefore, the right answer is option number B: persistent neck pain and stiffness. Where there is neck pain and stiffness because the neck structures that are impacted. There's going to be soft tissue injury of the neck where the strap muscles, thyroid, and everything that is there in the neck area gets damaged. There's going to be disc herniation also. And there could be even pain in the shoulders. There could be tingling and numbness in the arms and the fingers because the brachial plexus is injured. And there could be headache. So all these are the various symptoms that are seen during whiplash injury. Coming to the next question. Punch drunk syndrome is commonly associated with which of the following condition? Okay. So we discussed about punch drunk syndrome. What we discussed, it is seen in those areas where there are repeated impact that is occurring. Okay, like for example, when the person plays football, lot of times the ball can come and injure the head. Okay, so when there's repeated action over a period, where after a gradual period, there could be punch drunk syndrome that is seen. What are the options? Recurrent mild traumatic brain injury, particularly in contact sports. Yes, that is something we have studied. No, but we'll also look into other options. High fever and viral infections affecting brain. No. Fever is something that we have never studied for this question, so that is not the answer. Acute ischemic stroke, no. Chronic alcoholism leading to brain damage, no. Chronic alcoholic person who repeatedly fell could be something that could state punch drunk syndrome. But here they're just saying leading to brain damage, so that is not the answer. The right answer is option number A, recurrent mild traumatic brain injury, particularly in contact sports. When there's a lot of injury that is happening over a gradual period of time, there is going to be amnesia, there's going to be cognitive deficiency seen in the person, there could be depression, tremors, all these things are going to be seen in the person. Coming to the next question. A lucid interval is most commonly associated with concussion, epidural hemorrhage, subdural hemorrhage, diffuse axonal injury. What is the answer? The answer, obviously, such an easy question is option number B, epidural hemorrhage. In cases of epidural hemorrhage, in around 30 to 40% of cases, we see lucid interval. In 1 to 2% of subdural hemorrhage also, we could see lucid interval. Coming to the question, types of trauma interval first to asking this lucid interval. Let's look into the option. A period of unconsciousness immediately following a trauma. No. Unconsciousness usually happens, okay, whenever there is any high impact trauma. So that is not the answer. That is a common thing that happens. A temporary period of regained consciousness after injury before deterioration. Yes, this is something that states a lucid interval. Because we know that lucid interval is nothing but the period of regained consciousness where the person tries to apparently behave normal. Coming to option number C, the onset of seizures. No, we didn't discuss about seizures anywhere near lucid interval. Option number D, a state of confusion that lasts for hours. No. The lucid interval, you have to remember, is a temporary phenomena, which is a brief phenomena. It is there only for a very few minutes, there for a short amount of time. Therefore, the right answer for this question is option number B, a temporary period of regained consciousness after injury before further deterioration of the person. Got it? Coming to the last question, a pond fracture of the skull refers to what? Okay, so we discussed no pond fracture. Where is it seen? It is seen in skulls which are elastic. For example, in infant skull, we see pond fracture. Coming to the options, a type of depressed skull fracture. Okay, could be depressed with the bone is pushed inward, creating a concave shape. Yeah, could be. Coming to option B, a linear skull fracture that does not cause any significant displacement. No. If you have a linear skull fracture, what is a linear skull fracture seen? It is nothing but a fissured fracture. So that is not the option. Option number C, a fracture involving temporal bone. This is a temporal bone that leads to bleeding from the ears. Is that the answer? No. It is not the answer. It is nothing but the fracture of the middle cranial fossa where there is bleeding from the ears. Coming to option number D, a basilar skull fracture that involves cranial base of the skull. No, that is not. That could be a hinge fracture, or that could be fracture around the foramen magnum, but that is not the pond fracture. So the right answer for the pond fracture is, which is the right answer? Option number A, a type of depressed skull fracture where there is bone which is very plastic. Why it looks like a pond fracture. Got it? So these are the various questions that we had to discuss in this chapter. And after I have discussed all the law to the topics that we discussed, so that I can recall for all of you. I hope you all enjoy the session. Thanks for watching.